The Pentagon has reinstated restrictions on transgender recruits joining the military, according to a memo filed in federal court by Defense Secretary Pete Hegseth. The memo from last Friday bars people with gender dysphoria from joining the military and pauses treatment for transgender troops who require medical treatment. Effective immediately, all new accessions for individuals with a history of gender dysphoria are paused, and all unscheduled, scheduled or planned medical procedures associated with affirming or facilitating a gender transition for service members are paused, Hegseth wrote. The Defense Department's memo marks the latest volley in the controversy over the service of transgender troops and represents an initial salvo to reverse social policies at the Pentagon that President Donald Trump and Hegseth deride as woke. In 2016, then-President Barack Obama erased the Pentagon policy that kept people who did not identify with their gender at birth from joining the ranks. The Obama-era policy had also allowed transgender troops serving in the military to receive counseling and medical care for their condition. Trump's latest move reverses one of the Biden administration's first acts, itself a repudiation of Trump's 2017 announcement that banned the service of transgender troops. Days after taking office in 2021, Biden ordered the Pentagon to rescind the ban on troops based on their gender identity. In 2017, Trump surprised the Pentagon by announcing the ban in a tweet, writing that the Pentagon will not accept or allow transgender individuals to serve in any capacity in the U.S. military. Trump's policy, which took months to craft, required troops to serve based on their sex at birth. Transgender troops who had begun receiving treatment under the Obama-era policy were grandfathered in. Then Defense Secretary Jim Mattis said at the time that the Obama-era policy had eroded military readiness. Estimates on the number of transgender troops vary from about 10,000 to 14,000 of the nearly 2 million active duty and reserve forces. About 1,000 of them required treatment. A Pentagon-commissioned study determined that allowing transgender people to serve had minimal cost and effect on the readiness of troops to fight. Gender dysphoria results from the conflict between physical gender and gender identity and should not disqualify troops from serving, according to the American Medical Association and other major medical and psychiatric organizations. In a statement, Sparta Pride, an advocacy organization for transgender troops, said anybody who meets the military standards should be allowed to serve. There are already thousands of transgender service members currently in the military who have met the standards and have more than proven themselves, the statement said. There's no reason to deny transgender Americans the opportunity to serve or limit access to medically necessary care that all service members are entitled to.